And welcome back for News Talk. We're joined by Dr. Timothy Pfister to answer your questions about your teeth, your dental questions. The number to call is 315-793-WKTV. You brought me some brochures, and I love brochures, Dr. Pfister. So a couple weeks ago, we got a question. Someone who doesn't have health insurance wanted to know what are some options for paying for your dental work.
Yes.
So we have Care Credit.
Care Credit is like a credit card that a patient can use for a number of different services, not only dental, but veterinarian, chiropractic, ear, vision.
Any kind of health services.
Any kind of health-related issue.
Okay.
And it's a credit card that can be, it's just like a function just like a regular credit card. And then we have another service from Wells Fargo, who also have a credit card, which folks can use for that.
What's the advantage of using these rather than, say, your typical Visa, MasterCard, whatever you use for everything else?
Well, you know what? It kind of helps the patient to know that that's focused on health. So they can, separate their services and so forth. So that's one issue, of course.
Very good. And the phone number to call, again, 315-793-WKTV. We do have Dennis on the line, so we'll go to the phone lines and take Dennis's call. Hi, what's your question for Dr. Pfister?
Thank you, Katrina, for taking my call. Good morning. Good afternoon, Dr. Pfister.
Good afternoon.
Recently, I've had all my teeth pulled and I'm getting dentures, and I've noticed that I've lost my taste buds for everything. Will that come back after I get my dentures, or am I in a permanent state of mind on that?
So you haven't gotten the denture yet?
No, I've had a couple of fittings, and I'm supposed to get the new ones in about a week or two.
Well, you know what? That it is a big experience to go through all of that. So yes, eventually that feeling will come back, but you also have to take into account that with a denture, your whole palate is going to be covered also. So you're going to lose those taste buds to some effect. And what you might want to consider after you've had your denture for some length of time, maybe consider implants, which will allow the exposure of that palate again, which again has a lot of. You already are good.
Sure.
Good. Then that will be helpful.
Okay. So again, the dentures will actually, you won't taste a lot because it's covering a lot of the area of your mouth.
That's exactly right.
Okay, and we'll go to the phone lines again. And remember that number to call, 315-793-WKTV. We have Marianne on the line. Hi, go ahead with your question.
Hi, I have a tooth that has a root canal. And last week it was infected, well, it hurt real bad, and it was infected. So the dentist gave me antibiotic and pain pill. But I want to know why he's talking about having to pull it if it gets infected again. Can he go in and take the things out that are in the roots now and just redo the root canal and put the cap back on?
Yes, that's what normally you can retreat the root canal. The root canal system is almost like the root of a tree. There's so many little filaments at the tip. And so what you have to do is try to disinfect. Well, they'll take care of all that for you when they're retreating it, but some of those areas of the root canal system can remain infected or can lodge those bad bacteria that we want to get rid of, and in the process of sealing it, you are able to kind of allow the body to take care of that if you can seal it out of the root canal system. So, they can retreat that for you and you can still save your tooth.
Okay. And we'll go to the phone lines again. Remember that number to call, 315-793-WKTV. We have Chad on the line. Chad, what's your question for Dr. Pfister?
Hi, Dr. Pfister. I'm just wondering, do you take Medicare?
Our office, in terms of for sleep apnea, we work with Medicare. And we are not technically a provider, but we can work with the service of Medicare. So you just have to come in and talk to our folks, the front desk ladies. They handle most of those issues. They're more versed in that than I am, but we could try to work with whatever insurance you have, we can try to work with.
Okay. All right. Thank you so much, Chad, for that question. And the number to call again, 315-793-WKTV with any of your questions for Dr. Pfister. But it sounds like we're out of time. So, Dr. Pfister, thank you. It's always a pleasure, and very helpful brochures on paying for your dental work. And we'll be back after this. Stay with us.